Hello, welcome back to Food and Nutrition Expert channel. Of this channel for food and nutrition subjects and home economics. Today's topic we're going to talk about, I'm going to teach you about dietary deficiency. By the end of this lesson, students should be able to define dietary deficiency and explain its causes. Number two, differentiate between undernutrition and overnutrition. Number three, the students should be able to identify common diseases caused by nutrient deficiencies. Number four, the students should be able to state the causes, symptoms, and treatment of each dietary deficiency discussed. Number five, the students should be able to give examples of food sources that can help prevent specific nutrient deficiencies. Number six, the students should be able to explain the importance of a balanced diet in preventing malnutrition. The topic of today is dietary deficiency. Some diseases are caused by lack or shortage of specific nutrients in the meals we take. When this happens, signs of health imbalance begin to appear. When a disease is caused due to excess or lack of a specific nutrient, the condition is called malnutrition. To correct a nutrient deficiency, the intake of the missing nutrients should be increased. Now, what is malnutrition? Malnutrition means an imbalance in nutrient intake due to the consumption of too little or too much of one or many nutrients. Types of malnutrition. We have number one, undernutrition, a condition resulting from inadequate intake of food or poor utilization of nutrients in food. Number two, overnutrition, excessive intake of one or more nutrients to the detriment of proper functioning of the body system. Now, examples of dietary deficiencies. What are the examples of dietary deficiencies? Number one, we have kwashiorkor. The cause of kwashiorkor is lack of protein in the diet. This is common in children. Symptoms of kwashiorkor are enlarged stomach, hair changes color and looks thin, swollen legs, miserable appearance, scaly skin, retardation of growth and development. What's the treatment for kwashiorkor? Treatment: increase protein-rich foods, example meat, fish, eggs, milk, beans, granules, soybeans. The next one of dietary deficiency, examples of dietary deficiency is marasmus. Cause: protein calorie deficiency. Symptoms: stunted growth, child looks like an old person or skeleton, wasting of body tissue, saggy skin. What's the treatment of marasmus? Gradually introduce high protein, high calorie foods. So, include animal protein and energy giving foods, example milk, eggs, meat, fortified cereals. The next example of deficiency diseases are anemia. What's the cause? Lack of iron in the diet. That's common in women and children. Symptoms of anemia: weakness, fainting, pale skin. Treatment of anemia: include iron-rich foods, example liver, kidney, eggs, spinach, green leafy vegetables, beans, iron-fortified cereals. Then vitamin C intake should be increased to help iron absorption. So the remaining 5 dietary deficiencies, we have rickets. What's the cause of rickets? Lack of vitamin D, calcium or phosphorus. Symptoms of rickets: soft, weak bones, that bow legs or knock knees in children, delayed teething. The symptoms. The treatment of rickets: increased vitamin D intake, in bracket fish, liver oil, eggs, fortified milk, sunlight exposure. The calcium-rich foods: milk, cheese, yogurt, leafy greens. That's treatment. You have to increase calcium-rich foods. Then the next deficiency disease. The next deficiency disease has scurvy. What's the cause of scurvy? Deficiency of vitamin C or ascorbic acid. Symptoms: bleeding gums, weakness, joint pain, poor wound healing. Treatment of scurvy: eat vitamin C rich foods. Example: oranges, lemon, lime, guava, tomatoes, peppers, strawberries. Then the next deficiency, example of deficiency disease, goiter. Cause: lack of iodine in the diet. What's the symptoms? Swelling in the neck, enlarged thyroid gland, difficulty swallowing or breathing, fatigue. Then what's the treatment of goiter? Use iodized salts, eat iodine rich foods, seafoods, seaweed, eggs, dairy products. Then the next one, of example of dietary deficiency disease. So we have night blindness. What's the cause of night blindness? Deficiency of vitamin A. Symptoms of night blindness: poor vision in dim light or at night, dryness of eyes, bitter spots on the eyes. Then treatment of night blindness: eat vitamin A rich foods. Example: carrots, pumpkin, liver, sweet potatoes, green leafy vegetables. Then the last one is pellagra. That's another deficient example of deficiency disease. You have pellagra. Cause: what's the cause of pellagra? It's deficiency of niacin, that's vitamin B3. The deficiency of niacin, vitamin B3. Symptoms of pellagra. The symptoms are dermatitis, skin inflammation, that's the meaning of dermatitis, diarrhea, dementia, that's confusion, memory loss. Treatment of pellagra: increase foods rich in niacin, that is meat, fish, granules, whole grain, legumes. See you in the next class. Until then.